Welcome you all in this free webinar in which we can all we or give you a complete guidance on how to prepare it, what is this exam, what should you do, and how to ace this exam. It will be an interactive session. Definitely, I want to know each and every one of you when your problems as well. I will get your Q&A as well. What problems are you facing right now, or have any one of you get an attempt before for an MRCS or not? And related to that, if there is any distortion in my voice, or if I couldn't be able to get any questions from you, in case you can ask me again, because I am right in now stuck in a traffic for last, you can say, 20 to 25 minutes, and I have started because I have a commitment for you all. So I have started on my mobile phone. So in case if something happened, you can ask me again. Okay. So is anyone can tell me what do they know about MRCS? What is MRCS exam? Everyone can, even anyone can tell me. It's not an you can say an exam for this webinar is not for an exam. So if you have any thought about it, what is MRCS, and has anyone before done given this exam and didn't get up to the passing marks, so share, you can always share that as well. Can anyone tell me what is MRCS exam for? Am I audible to everyone? Sorry? Sorry, can you repeat it? As Dr. Azadar Hussain. Am I right?
Yes, ma'am. MRCS is a two-part examination, Part A and Part B. So,
Hmm.
Part B is like entry-level exam for, uh, you can say, like for specialization like FCPS or JCAT in Pakistan. So, that's what I've heard of.
Okay, okay. It's like you say it correctly, but it's actually a membership exam for a royal colleges. It's a four royal colleges in UK and Ireland that they taken those exam, and after that definitely you get for a speciality ST4 training in UK or Ireland. And even if someone have passed pleb route, even if someone have passed the pleb, so they definitely after like core training or ST1 and 2, they have always go to and give MRCS exam if they are pursuing for a surgery. So yes, this is a membership exam for royal colleges. After that, you get a ST4 training level in UK and Ireland. Okay. So yeah, it's two parts, part A and part B. Part A is, you can say, a theoretical or MCQs based, multiple choice question based exam, and part B is actually a complete, you can say, clinical and practical exam, in which you have like have done, all of you have done an MBBS exam, and you know that we have gone through and OSCEs, and you have gone through like vivas and all that. So part B is somehow like that kind of an exam. Okay. So pursuing to, you have an understanding of like what is MRCS Part A exam for. It is a like designed for candidate knowledge about applied knowledge and basic medical sciences, and definitely I will go into deep what in which what are applied knowledge of basic medical sciences, or what are the core surgical principles. And this is not, you have to keep in mind that is not a memory based exam, it is your conceptual based exam. Sometimes that is a, you have heard multiple resources for MRCS Part A exam, you have heard like a single question, but in your exam it is not like that same question came into it, but with a different, typical different scenario will came it. So definitely with the same options, but a slight difference in a scenario situation can flip the MCQs, or you can say flip the answer to that question, right? So it is not a memory based. It is not you can say it's totally conceptual. You have to clear your concepts and grasp it, and don't just go through the wording or resources you have for MRCS Part A. Okay, so that is your, you can say, I don't know, if we divide the MRCS Part A exam, it is divided into these topics. You can say you have an applied anatomy. Applied anatomy is a major chunk in an MRCS exam. You have no, you can say, each and everything of about an anatomy. So even it's bones, even it's a muscle, even it's organs, each and everything about anatomy, you have to know it. It's a major chunk that came in exam. And then we have the applied physiology, in which we have CVS, respiratory, renal, endocrine, and stress response. That stress response is actually a definitely it is a surgical exam. So that stress response is about the stress response of a surgery, right? Or what will happen to the body after the surgery, and what changes will be happened in the body after the if any patient or if any person went to the surgery. Are you guys getting my point? Anyone can say it. Okay, yes, no. Okay. Next, moving on to, we have the pathology. Pathology, in which you have to know the general physiological and surgical pathology, in which you have to know the, what is the necrosis, inflammations, systemic and surgical pathology. We will that you have to know. Then we have the applied pharmacology. In pharmacology, that you don't have to know the mechanism of action of each and every drugs, like antibacterial, antiviral, or antifungal medications. You have to go through during your MBBS. But in the pharmacology section, you have to grasp the knowledge about the anesthetics medications and any drugs we have to use in a patient. If any patient in a surgical ward went into, you can say, shock, MI, or anything like some you can have a patient you can say went into a septic shock, or any medication you go for a leprotomy, and these kind of medications you have to know about during the MRCS Part exam. Then we have the principles of wound surgery, in which you have to get the wound healing, perioperative care, and oncology. And next we have trauma and critical care, very important section of the MRCS Part A, in which they will even ask you about the fractures. Even they will ask you about this you can say trauma and critical care came in like ATLS, shock, ICU basics, and ventilation, and even got orthopedics. Yes, orthopedics, fracture, spine, bone pathology. That is also a part that came to MRCS Part A with a major chunk. Okay. Then we have ENT and ophthalmology. That's like you can say any emergency situation that you can face in an ER. So it's just you can say an emergency situations of ENT and ophthalmology. Then we have ethics and statistics, in which you know the patient safety, professionalism. It's like NHS have some consents form. NHS have some rules and regulation of such each and every kind of a patient, how you will tackle them, how you have to admit that patient, or how you have to counsel the patient about any surgical procedure. So yeah, they will ask you about that. Then we move on to the, you can say, what is the exam structures and cognitive levels. So, in exam structure, that is a part A exam consists of a 300 multiple choice questions, and in which part A further divide into a paper 1 and paper 2. Paper 1 is approximately 180 MCQs consisting of applied basic sciences, and paper 2 is the principles of surgery. Okay. Everyone getting my point? Is there any questions you can ask me? I'm happy to answer them. That's webinar is the main purpose of this webinar is that your concepts, your questions get answered. So please let me know if you have any query or if you didn't get any point. So I'm happy to answer that. Then, is anyone have any question? Okay, so am I audible to everyone? Is everyone can hear me?
Yes, ma'am.
Thank you so much. It will be a really, you can say, great thing if you each and everyone answer me because it's like I'm speaking to myself. Actually, I'm thinking like that. So please answer me when if I ask you something or anything. You can all like speak or say anything. Then we have the. I told you that we have a 300 total, 180 for applied medicine. You can say applied surgery, and then we have principles of surgery. It will be the 160 MCQs. Now further divided into we have applied anatomy can consist of the 140 to 150. As I told you, that is the highest weightage. Physiology can be a 40 to 45. It's a rough estimation of these MCQs. They can be varied differently. Okay, it is not you can say authentic, or you can say it's not a pet questions that will like 40 MCQs or 40 questions which came from applied physiology. So it is a variations, like it might be a 40 to 45 or it might be a 140 to 150 MCQs that came. Okay, then we have pathology 40 to 45, pharmacology is 20 to 25. Its main purpose of this slide is that you note the um weightage of the topic you have to go through, right? It's like you have to grasp a major knowledge of applied anatomy. You have to grasp knowledge of, you can say, then we have the physiology and then pathology, because that is a major chunk that these questions came from. Is anyone know the passing criteria or passing you can say how will you know that your exam have been passed? What is the passing ratio or a passing percentage of this exam? And I have to tell you that paper one is and paper two have to be passed, you can say, collectively. So you have to get that um, desired percentage of an exam. So can anyone tell me what is the passing percentage of paper one and paper two, or like part A, paper A? How can you say that paper MRCS paper is passed or not? Anyone know or doesn't know? Doesn't know anyone? No. If anyone know that, it will be a good thing. We this can be add further knowledge in our everyone between everyone. So anyone knows, do tell me. It's approximately 75% age is required to pass a paper. And it is not like you have 300 MCQs and if you get a 200 MCQs correct, your paper will be passed. No, it is a relative percentage marking that you will be, you can say, in top 20 to 25% of the people or persons that have given that exam that day. And I have to tell you that all the four colleges took the exam on the same day. So yes. Is there this have any is this any question regarding that or not? Can I move forward or should I stay here? Is there any questions? Okay. Now, further divide, we have the principles of surgery, that is 25 to 30, and trauma and critical care is 20 to 25, orthopedics is 15 to 20, ENT ophthalmology is 10 to 15, and ethics and statistics can be 10 to 15. Guys, can you get me just 5 minutes? I will be back. I'm going to connect it with my laptop, so I will be continue from this shortly. Just 2 minutes. Okay, guys, can we move on next?
نعيط. ها هذيك لقيتها مدودة طيشتها والله نجاسة هذيك بخاف كليتها هذيك
I think so. Someone's mic is open, so I don't know what is she saying. So, can you have a? Do you have any questions? So do let me know. And if you have something not related to this, so can you please turn off your mic? Now we have, you can say, applied anatomy. That is a high yield core in which you have, already told you that the major chunk from the applied anatomy. In this, you have to know the anatomy of, like, you have to correlate it with surgically, like, such as you have to know the hernia repair, thyroid surgeries, vascular access, orthopedic approach. Also, you have to correlate the anatomy with CT or MRI. Okay. Now we have the physiology. Physiologically, you have to know the questions related to like cardiovascular dynamics, surgically relevancy. Then we have the respiratory mechanics, renal regulations, acid-base balance is major chunk, and then we have acid base balance is like 4 to 5 questions is based on acid base balance, and endocrine responses to the stress is, I have already told you that stress is actually the surgical response. Then we have to know the understanding of graphs, loops, and feedback mechanism is mandatory, that is related to the endocrinology, or if anything like stress response happened, what mechanism will be activated and how it will regulate all the body. Then we have the pathology. Pathology, you have to like then know the mechanism of inflammatory pathways, disease mechanism, wound healing, neoplasia, systemic responses to the trauma. And histopathologically, you have to interpret the clinical correlation, and it is some frequently it is came like they can give you an histopathological picture of histopathological. Either they can give you findings and can told you like tell me what are they, or either they can even put an image of you can say histopathological slide and ask you about that disease. Then we have the pharmacology. Pharmacology, I have already told you, know the anesthetic drugs, autonomic drugs, analgesics, antibiotics, and now and also you have to know the anticoagulants. Anticoagulants is also you can say that is a one thing that the MRCS exam or mostly asks you about it. Know the contraindications, side effects, or interactions of perioperative scenarios. Paper two is principles of surgery. They can either came from a trauma management, critical care, orthopedics, ENT, ophthalmology, and professional ethics. Questions are usually a scenario based. That is an important that part. Paper two is mostly a clinical scenario situations, and even they can ask you about a diagnosis of that situation or a scenario, or either they can ask you about the management of that patient, or either they can ask you that the patient haven't underwent this particular condition, have this particular condition and have underwent that surgery, this complication have happened and you have done that thing to that complication, but situation doesn't improve. Now what will you do? So in this kind of a scenarios can came into then we have what learning tools. Definitely we know what are the but now we have know that what is the MRCS exam, what to know, and what are the questions, or you can say we know that. Now you have to know how to study it, what to do for that, how to prepare this exam. For that, you know that repetition is you can say that repeat and revision is a one thing that can be a tool for this. There are concepts that you will not grasp it in a one day or a single read. You have to repeat it, revise it again and again. So it's really important that you know that you have a maximum time for that, that you can have get a revision for a particular scenario or situation. Now I will even told you that you have to know the integrated revision approach. You have to integrate the anatomy, pathology, and physiology. That's really important. For example, that you are studying the bowel ischemia, so it indicates so it includes vascular anatomy, definitely ischemic physiology, and pathological outcomes. So you know that you have to integrate anatomy, physiology, and pathology outcomes. Now we have the mocks exams and performance analysis. Even you can have to go. I would suggest that you have to go for a mocks exams, that you are studying in an exam situation, and now you have to. In that day, you will be like more confident and tackle the stress of the exam. So mocks can improve the your like even the concepts, or you can say that you can tackle the exam stress better in way. Then I would suggest that last 6 weeks should be not the first time you are going through a topic. It should be an advanced phase in which you should be focused on rapid revision, image based anatomy, recall questions. Recall questions is like you can say that it's a past questions. So it's like many you can get a question banks of recalls, that in which you have the questions of the past papers, like the questions that came before in the exam. So yeah, you should focus on that, and no new resources should be introduced during this period. So during last 6 weeks should be solely focused on revision, I would suggest that. Then next, the exam day. Exam day is MRCS requires mental endurance. I would suggest that it's top. It's not your, you can say, your knowledge based exam. It is your mental endurance exam. Definitely 300 questions is a huge MCQs you have to go on that day. So yeah, then we have candidates must avoid over analysis. Yeah, you can say that patient have gone through this. So might I have to go through this? No. I shouldn't be doing this. Now I should have to correct. No, they are not asking about this. I have also I have already told you that they can ask you a single. Even they can ask you about the same scenario you have read in your you can say recalls, or your you can say you have read the same scenario in your resources, and then they ask you about something that was similar to that scenario but in a different way. So you got confused, like, no, this is not I have read this question, this is not the one I have read, so this is a different scenario. So don't over analyze. Don't don't think about you have read that somewhere. Think about is the what is the your scenario or questions is right now in front of you. Okay. Now you have to know the apply the elimination technique. You have to exclude that the options, that this is not the right, this is not the right. So you have to, like, they are asking about, for example, they have asked you about the patient who has underwent the septic shock, have a septic shock, and he had the laparotomy underwent. So now the patient is in the septic shock, right? They were asking about, like, what will be the main cause of the ischemic bowel. So your exam got stuck in, like, you can say, in a septic shock, and you are thinking about the septic shock, and the options are were mixing both in a septic shock and ischemic bowel. So you should be carefully read the scenario. You should be an active minded. So also you should be have to know that how to eliminate the options that they are asked, and know your trust your preparation. Calm decisions making significantly improves the outcome. Now, what is steps for MRCS Part A? The step one is you have to understand the exam properly. I'm sure that you have know that what now that what is the exam structure, what is the modules, what are the weightage. I think that you are being able to know this situation. Then you have to step two is build the strong core sciences first, definitely. So start with applied anatomy. I would suggest that is a top priority. Then study physiology, pathology alongside with anatomy, and focus on clinical relevance and surgical applications. Step three should be, I would say, that use limited but high yield resources. Don't go like 4 to 5 books of same you can say anatomy. For example, there's an anatomy and you have to cut 4 to 5 books for preparation of an anatomy. So at then you will not able to revise it. So one main book should be focus for a single subject. Okay. And one reliable question bank, either that is you can say a past test or a EMRCS question bank, anything you want, but that should be a one question bank, and one main object should be your main focus. So at the end you will be able to revise that single thing more effectively. Question based learning should be start early, not at the end. Analyze why each option is right or wrong, and maintain an error log for weak areas. So you should know that I this was an MCQs, I corrected it wrong. This is my error. So I should remember that. Like even you have to know that this is a main topic. So I know that I'm weak in that area. So you should focus, and your top priority should be to focus on that. Then we have integrate subjects. Like I have already told you, you should integrate anatomy with imaging, physiology, and pathology. Think like surgeon solving a clinical problem. And step six should be a revision cycles. Weekly minimum revisions should be done, and monthly full revision should be done. And 4 to 6 weeks, I have already told you, should go through revisions and recalls and questions only. Then mocks exams, they are really effective, really, really effective. I would suggest that I have passed my MRCS Part A exam. I would suggest my preparation for MRCS Part A exam was for, you can say, 3 months. In the last month, I have only prepared for revisions. I have given the mocks exams, and I would suggest that I have done recalls and questions banks in last 1 month for my exam. So definitely mocks exam can get, like, you have to go for one question should have a minimum time of 1 minute. Yeah, so that scenario and that quick learn, you can say a test based learning should be given in a mocks exam. So even they can even focus on the patterns of mistakes and improves the time management and stamina. Final phase strategy step 8 is no new topics or resources should be used in the last days. Just focused on anatomy images, repeat your concepts, and weak modules should be your main focus on. Exam day should be, I would say, just stay calm, have a good breakfast, have a good sleep, and use elimination strategy. Like I have done that, I'm good in it. I will ace the exam tomorrow. So avoid overthinking. Just stay calm. Three principles is consistency, smart learning, applied thinking, and that will lead to your MRCS exam. So during the exam, your mindset should be, I would suggest that future surgeons. I've definitely you all are here have definitely passed the you can say that have passed these 5 years of the MBBS, and inshallah and definitely you all are going to be a surgeon's future in future. So start thinking like surgeons, and your exam should be like you are going to be a surgeon. So mindset of a future surgeon should be a top priority if you are sitting in an MRCS Part A exam. So daily routine of for a study should be start early, go hardly, plan your study, take it seriously, and don't distract yourself during your preparation. Many people will come in your life or in your daily routine and told you that what are you doing this, there is no future scope, there is no future scope in this MRCS, there is always a saturation in NHS. Always people will came in and give you suggestion like don't go this, do this. Don't take them seriously. Okay, they are only your distractions, and they will only provide you, I would suggest that will distract you from your routine or your study. Read textbooks, review with your peers, and practice. Now, what EM Med Masters are offering you, then we will give you a module wise live classes. We can give you a recorded lectures. There is a WhatsApp support group in which we can give you an instant guidance and peer discussion with each other, and updated study material, and high yield exam focused content will be our top priority. Then latest exam recalls with better understanding of the exam patterns. Topic based tests will be done like we will identify your weak areas early and told you that how to ace that and how to recover from that. Expert study based, efficient, time saving preparation studies, full exam preparations we have, real exam experience, time management, and flashcards for our fast wins and long term retention. And why candidates should use EMED masters, that they are designed by experienced mentor with an exam focused curriculum, and aims to help students finish their syllabus, practice questions, review weak areas before the exam. So, is there anyone have any questions to let me know? I have got some question like someone has asked me about what study material for pathology have to be used. So, for pathology, or even I would suggest that there are multiple notes for MRCS Part A. Even we have MRCS Salah notes or MOS Rida's notes, or we have the Umaima notes. There are multiple notes. You have to know your caliber, that what kind of information or you have your caliber for a preparation, right? So you should know that my if you ask me about me what I use for my study preparation, I used the MRCS Salah notes, and I have always used the recalls. There are multiple recalls books available, even the online websites. There are even in the eMed Masters, we have the recall book in which we can send you the recalls daily, or even if you started it with us. So yeah, and then you should might I would suggest that you should be your revise and revise and revise. That is the only strategy you should have. Okay. Is there anyone else have a question? My question is, she MRCS RCSI is same as MRCS? Yes, it's same. MRCS is a single. I would suggest that it is done in the inter college. It is taken by inter college uh, board of surgical exams. They took that exam, and yeah, that's the same exam by that have taken by all the four colleges on the same day. Yeah, it's the same. Is there anyone else have a question? We have Dr. Asdar Hussain, and we also have Dr. Samreen. Can I speak to Dr. Samreen? For anatomy, short snell book is enough. And even if I have, as I have told you about the MRCS Salah notes, that is in which you always, that's a complete book in which you will get anatomy, physio, patho, applied surgical, each and everything in that book. And for a question bank online, I would suggest that you should use EMRCS and EMRCS question bank pool. They are really effective. And in that question bank, I would suggest that they have only focused on the areas in which in which that actually that membership exam have focused on. Okay, thank you. Is anyone else? Yes, each and everything is included in our course. Definitely, in this course, we will tell you each and everything about even we can provide you whole material, and even we have designed the mocks and have also live sessions for that. And yeah, you will get the details about the admission fees and how when the course is starting. You will get that after you contact us on the WhatsApp. And definitely, that's the exclusive offer right now, that you will get 30% off for these webinars attendees, that we have 8 to 9 people right now here. And there's also that you have to know that the MRCS exam is actually how many times is taken per year. So the course is according to the exams. If that there is a September, next is the coming is like September exam is coming up. So our course will be starting from the 1st June. Is there anyone else? Kiran's, Asdar, Samreen, Dr. Shiza.
Okay. Yes, ma'am, I can listen. I'm in ER, so
It's okay.
sorry.
It's okay, but do you have any other question or is there anything you want to ask about this exam? So actually, I'm winding up the webinar right now. So that's why I'm asking each and every one of you. So if they have any question regarding anything or regarding if you have any confusion right now, I can answer it right now.
I have one query in my mind. Like, EMRCS subscription is for 4 months. So I have booked the 9 September exam. So if I book the EMRCS right now, so it will finish like 9-10 days before my exam.
Hmm.
So should I wait? Is it important to keep the EMRCS subscription till the exam date, or is it okay if it ends 9-10 days before? So this
Yeah,
was.
EMRCS is also included in our like EMED masters in our course also. But if you have taken the subscription of that, it's up to you. But if you want to join our session or our course, that will be included in our course as well. And but if you have kept that, so it's up to you. You want to use it from there or you want to join our course, it's up to you. But I would suggest that if you have the EMRCS or EMRCF subscription and have a question bool bank, it's just a solely a learning for you that you will know what is the scenario, what kind of a scenario came in your exams and all that. So it's not 100% sure or 100% surety that that same question will came into your exams. So you have to know the differences between that. EMRCS is for your learning based. It's not the 100% surety that the same question will came into your exam. It's solely like the question a stem that what kind of a question will came in your exam. And past test subscription is prior to EMRCS. It's other people you can say mindset, but it's up to each and everyone who have taken the exam. EMRCS is also good. Past test is also good. These subscriptions and these question pool is mainly for what kind of a questions can came in your exam. It's not the 100% surety or even it not the you can say truthful that the same questions will came from your these question pool. Do you get my point, Dr. Asdar Hussain?
Yes, ma'am. I got your
Okay,
point.
okay, okay. Okay, share, Dr. Share. Is that fine? I don't know. I don't know anyone from the past as that why they charge more money for subscription than EMRCS. I don't know. You have to contact some person who have been working in the past as they can tell you more about it that why they charge more for subscription. I don't know. Okay, Dr. Shiza and Dr. Kiran. And we have also a Dr. Malaik Kamal, I don't know, Malaik's. Okay, now I think that everyone have got their questions and I have answered them all. And that's an exclusive offer for every one of you who have joined our webinar today. And we have got 30% off for the webinars. And if you have got the query about when the session will start and what is the subscription, all that you will get on this question WhatsApp number. Even we have also shared in chat. Okay, Sarah, can we end it?
Yes, thank you so much, Dr. Shazina.
Thank you. Okay, thank you so much, each and everyone who have attended this webinar. I hope that this was helpful for you all, and I have able to answer each and everyone